Hi everyone, my name is Steve Stump. I'm the principal agent at U.S. Benefit Advisors, and I really enjoy sharing with you the knowledge I've gained about how our healthcare and specifically our health insurance industry works. You know, I've used the analogy in the past that health insurance is like car insurance when it comes to the companies protecting themselves from their claim losses. Car insurance companies have to insure good drivers with bad drivers. If they only insured bad drivers, they would lose their butts on their claim losses. Health insurance is the same way. And I want to talk about the Affordable Care Act and how the regulations that came with the ACA impacted the insurance companies, the hospitals, and big pharma. So let's talk about the insurance companies. As you remember, when the ACA was passed, there was a penalty if you weren't enrolled in an ACA-approved plan. Now, thankfully, with the current administration, that penalty is no longer enforced. But what this caused was everybody was required coverage. Now, if you met certain income thresholds, the government would pay you a subsidy for your premiums. So what happened with big insurance? Revenues skyrocketed because they had more covered people in their plans, and the government was paying for a portion of those individuals to be in those plans. And lastly, these big companies were now including healthier people into their plans so that when they had large claim losses from the chronically ill, they could offset those losses with the amount of premiums and the expenditures that they had to make for their healthier population. The next one was hospitals. Now this one was really interesting. With hospitals, now more people had coverage, more people were getting subsidies, and therefore had coverage with the insurance companies, which meant the hospitals were serving more covered patients. Now, there is a law, EMTALA. It stands for the Emergency Medical Treatment and Labor Act. Now, what this meant is that when more covered individuals are coming into the hospital, and EMTALA requires that they must treat everybody regardless of their insurance coverage or not, they have less uninsured and therefore less losses. So what happened with the hospital revenues? They went up. The last piece of the ACA impacted big pharma, and in a really positive way. There are no lifetime maximums for drug cost. So what that means is big pharma can justify the cost of their drugs by saying this cost tens of hundreds of millions of dollars to develop in their research and development wings, and therefore justify the cost for the insurance companies to have to cover, and in those cases where they don't, then the consumer must as well. The Affordable Care Act was disguised as a way to bring affordable care to all, but in reality it helped big insurance, it helped hospitals, and it helped big pharma increase their revenue. I encourage you to take a look at other plans that are available out there that don't necessarily focus on insuring the chronically ill with the healthy population, but instead they have an underwriting process that ensures they don't cover the chronically ill. These plans typically have a first dollar benefit. They will have no copays and no co-insurance, and you're likely going to save 40 or 50% on your premiums. When you get into an ACA plan, you're feeding the monster. When you shop for your plans, you're finding the right one for you. Again, my name is Steve. Check me out online at insuremesteve.health. Again, that's www.insuremesteve.health. If you have questions, feel free to send me a direct message as well. Thanks and have a great day.